Pediatric lymphoma. Lymphoma is a type of cancer that develops in the lymph system, part of the body's immune system. Because lymph tissues is found throughout the body, the lymphomas, non-Hodgkin's and Hodgkin's, can start in almost any part of the body and spread to the other tissues or organs. Pediatric lymphoma is the third most common childhood cancer.
Lymphomas are cancers of the lymphatic system. Cancers occur when a cell or group of cells go out of control and keep dividing to make more and more similar cells. These are not helpful to the body. The aim of treatments for cancer is to kill the out-of-control cells. But most treatments that kill cancer cells will also kill or damage normal cells. So there is always a balance between killing cancer cells and making sure that normal cells can recover well afterwards. The lymphatics are a system of fine tubes that drain a fluid called lymph.
Hodgkin lymphoma. Hodgkin lymphoma, also known as Hodgkin disease, most commonly affects children aged 15 and older. Children with the disease typically have abnormal cells called red stem cells in the cancerous lymph node. These cells may develop from a type of lymphomatosis known as B cells.
Lymphoma is a cancer of the lymphatic system, which contains lymph nodes and vessels. The lymphatic system carries lymph and white blood cells throughout the body. The purpose of the lymphatic system is to fight infection. Most lymphomas are made up of either B or T white blood cells. Lymphomas
Nuclear sclerosis. Lymph nodes contain scar tissues, normal and abnormal lymphocytes, and red stem cells. These subtypes affect 70% of children who have Hodgkin lymphoma. Mixed cellularity. Lymph nodes contain inflammatory immune cells and red stem cells. Lymphocyte predominance. Abnormal lymphocytes and red stem cells are concentrated in the cancerous lymph node. This form is also more common in younger children.
If you've been diagnosed with non-Hodgkin's lymphoma, you should have the opportunity to visit with your treating physician about the exact nature and stage of your cancer so that you know what to expect from the treatment and also have a clear understanding of the goals and limitations of treatment.
Non-Hodgkin lymphoma. Non-Hodgkin lymphoma is more common in boys and girls. The majority of non-Hodgkin lymphomas are highly aggressive and fast-growing. Based on the way that the tumors behave, the subtypes of non-Hodgkin lymphoma that develops in children differs from those that develop in adults.
The lymphatic system is part of the body's immune system, which is responsible for keeping the body free of disease. The lymph nodes throughout the body are connected by a network of lymph vessels. Lymph is a fluid found within the lymphatic system that contains lymphocytes, infection-fighting white blood cells. In the nodes, bacteria and other dangerous substances are filtered from lymph before fluids are returned to the bloodstream.
Symptoms. The most common symptom of the lymphoma is one or more enlarged lymph nodes in the neck, underarm, or groin, which are usually painless. Enlarged lymph nodes in children with lymphoma may resemble the swollen glands of children who have a throat infection involving the lymph nodes.
We're going to hear from a lymphoma cancer survivor. There have been 75,000 cases. At the time we're talking about, new cases every single year. This is one of the deadliest cancers of young women. Okay, let's see her story.
I had sharp shooting chest pains, flu-like symptoms, and I was exhausted all the time.
So that young...
If the lymph node remains enlarged or continues to grow after antibiotic treatment, the doctor may need to remove lymph node cells or tissues to examine it for signs of more serious conditions, such as lymphoma. This can be accomplished by removing cells through a fine needle aspiration procedure under local anesthesia, which may lead to a lymphoma diagnosis. If a diagnosis is not obtained using this method, a surgeon can perform a more extensive biopsy procedure to remove lymph node tissue while their children is placed briefly under general anesthesia.
Hi, I'm Dr. David Hill, and today we're going to be talking about signs and symptoms